On the count of three, I want everyone to call out what they know to be the gateway drug. Ready? One, two, three. Right. Marijuana, weed, pot, whatever you want to call it, that's what we all have grown up to learn was the gateway drug. Now, I kind of want you to throw that out the window, and I actually want you to encourage you to go out and vote to legalize marijuana in Tennessee. And that might sound crazy because it did to me at first too. But growing up in a place where marijuana was taught to us as a terrible drug that would ruin your life and make you addicted to all these other drugs, my mindset was completely changed when I moved to Oregon at the age of 15. There in Oregon, my dad actually farmed and sold marijuana and hemp. And myself being skeptical of this at first, I did a lot of research and I also saw and learned a lot from what I observed of what he did. And it turns out that marijuana can actually be very, very beneficial to so many people, especially in the medical field. And I really truly believe that if we legalize marijuana, that it will work wonders for the healthcare field. So to begin with, marijuana can be very effective in treating symptoms of chronic pain. And this includes people who are cancer patients. So there's a book called Marijuana in Medicine, Assessing the Science Base, written in 1999 by Janet Joy, Stanley Watson, and John Benson. And in the book, there's a case study that actually shows that the effects of a THC pill on a cancer patient. And the results showed that 10 milligram pill of THC decreased nausea and vomiting in the patient, increased appetite, and then also the mood of the patient was enhanced and their anxiety was lessened. So clearly, THC was actually very helpful for this one cancer patient. And not only that, but we would also, by using marijuana, be able to decrease the amount of opioids we use to prescribe to people with chronic pain. There's one study conducted in 2019 called The Impact of Medical Marijuana Legalization on Opioid Use, Chronic Opioid Use, and High-Risk Opioid Use. And in this study, it was concluded that prescribing opioids was much less common in states where cannabis was legalized and normalized. And this just goes to show that marijuana could be a much better and less harmful alternative to using opioids, and it's still just as effective. In addition to treating pain symptoms, there are even studies that show how marijuana has positive effects on mental health and even on disabilities such as autism. A clinical study called Cannabidiol and Anxiety and Sleep, a large case series, which was conducted in 2019 by Shannon S., Lewis N., Lee H., and Hughes S., found that out of a random sample of 72 adults struggling with anxiety, 79.2% of them saw a decrease in a plateau of anxiety throughout the study. Not only that, but there is also research to support that marijuana can actually reduce the functional impairments that come with autism. A study conducted in 2018 called Oral Cannabidiol Use in Children with Autism Spectrum Disorder to Treat Related Symptoms and Comorbidities demonstrates improvement in behaviors such as self-injury, rage attacks, hyperactivity, sleep problems, and even anxiety in children around age 11 who have autism spectrum disorder. So now, as I've just provided sufficient evidence on the many medical benefits of marijuana, I can only ask now that you try to see the positive outcomes and consider going out to vote to legalize marijuana, because once we legalize marijuana, we will be able to regulate it and move forward with helping people get the help that they need. As I just mentioned, all those people like chronic pain, mental health, and so on, like it can help so many people. And going along with that, as I said, legalization would benefit those who struggle with all sorts of different diseases And there are even some cases where it can actually reduce it so amazingly. And there was one case, one girl's story, her name's Charlotte Fiji. And this is a picture of her. And she, from the time she was a baby to the time she was 3 years old, had about 300 seizures a week. And now, after using cannabis at the age of 10 years old, has reduced that number of seizures to 2 to 3 times a month. And to me, that is just outstanding. Like, it's just crazy to think that marijuana could do so much for this young girl. And overall, the benefits of marijuana, just there's so much that we have to learn, and we've already seen how much there is to benefit from all these case studies. And I really do think that marijuana can change the healthcare field for patients, for doctors, and for the families of those patients. So, on behalf of those who suffer every day and those who work in the healthcare field, I'm asking you to go out and vote to legalize marijuana, because marijuana has so many benefits that we have seen already. And by legalizing it in Tennessee, we can continue to see those benefits and help people who struggle every day and be able to reach the full potential that cannabis has to help us. Thank you.